Today, the Terrebonne General Wound Healing and Hyperbaric Medicine Clinic received Restorix Health's Wound Center Excellence Award.
I am. First of all, I just want to thank everybody for coming this afternoon. We have some beautiful weather, so it's tempting to be outside, so thank you for definitely coming to share this moment with us. But today we'd like to commemorate this wonderful achievement for our Wound and Hyperbaric Center. For those of y'all with our Wound and Hyperbaric Center, would you please raise your hand? I see all of you right there. These are some amazing and wonderful people. So many of you can know our history. We partnered with Restorix Health for over 5 years, and we've grown our Wound and Hyperbaric Center tremendously. Not only through the efforts of Restorix, thank you very much, but also, again, with the dedication and commitment of all the individuals that you see here. They have done an amazing job. We've treated over 2,300 patients successfully and restored their quality of life. Many people don't recognize how quickly this is devastating to many people, having some type of injury that will require a wound or hyperbarics. And many people didn't even know what hyperbarics was for a long period of time. I'll let Dr. Isabel touch on that. You didn't know you were, but you will. So thank you very much. But with that, I do want to hear today a testament of how patient care is excellent, thanks to our team, as I mentioned.
Hi, everyone. My name is Celeste Thibodeau. I'm the program director at the Wound Clinic. At the Terrebonne General Health System Wound and Hyperbaric Clinic, we provide comprehensive wound care to the community. We are fortunate to have access to many different modalities that we are able to provide, including hyperbarics. With hyperbarics, we are able to provide the patients with a resource that is not available at many clinics in this area and increases the chances of a positive outcome. We work in conjunction with many different specialties throughout the community to aid in the healing process and provide the patients with the best outcome possible. With our staff, we are comprised of many different varieties of different backgrounds that together as a team, we are able to provide exceptional care to the community.
Now, Ms. Stephanie, would you please come on up? And I understand you have an amazing award you'd like to present our group.
So hi, my name is Stephanie Rivera. I'm the Regional Director for Restorix Health. I was selected today or invited today to honor Terrebonne General Health System with Restorix Highest Achievement Award, and that is the Center of Excellence. This award recognizes centers for their excellent, exceptional patient care, their optimal outcomes, and their patient satisfaction. And Phyllis, I'd like to extend this to you and as a thank you to you and your team for their dedication to the community as well to the patients that they serve.
Thank you. Thank you. And we all know that I get the opportunity as the CEO to get these wonderful awards presented to me, but we all know who really earns them, and that's our team here. So thank you so much for all that you do. And I see Dr. Kaz walked in also. He likes to hide in the back. So for everyone here and Dr. Kaz, who's also part of our team, thank you so much for this amazing award, Stephanie. We definitely appreciate it. I don't want to break it, so I'm going to set it right here so everybody can get a picture at the end. It's beautiful. Thank you so much. Now what I'd like to do is mention how amazing and proud we are for this amazing award, but to be recognized for all the efforts, as I mentioned before, that it takes to do this. It is a prestigious award, and it means that we have reached and exceeded national standards in wound care quality benchmarks. As Stephanie mentioned, it distinguishes Terrebonne General as an exceptional provider in several categories, meaning healing benchmarks, adherence to clinical practices, patient satisfaction, that we are in the 96th percentile or higher. So that is always an exceptional thing. The bottom line is that we are very aggressive and assertive and trying to fix you when you don't feel good. And we are very compassionate about how to make sure our patients feel better. Our clinicians are trained in an amazing way, and they have the heart. They have the heart and soul to do all of that. And I think we'd be amiss without recognizing one of our patients or their daughter who wants to come up, Mr. Roy Bro. And his daughter wanted to talk about his story, Miss Angela. So maybe we can hear from a bird's eye view the difference that this makes.
My name is Angela Boudreau, and I am speaking on behalf of my dad, Roy Bro, in the back. And I'm also speaking for my whole family that's pretty much back there. My dad is very humbled to be honored today as a guest. To make a long story short, I'll give you a rundown of the events that happened before he got here. He basically had 7 surgeries, starting with an aneurysm, stents, vein bypass, 2 weeks in rehab, open wounds, and somehow we got led to doing 2 muscle flaps and being presented here at wound care. So, and he had 40 hyperbaric treatments. So when we got to wound care, we always felt welcomed and comfortable whenever we were greeted. I mean, everybody greeted you with a smile. Everybody was positive and encouraging. The wound care doctors and nurses were very attentive to my dad and his feelings and his concerns. They answered all of his questions. They worked hard with all the doctors involved in my daddy's case to make sure that the care protocol was perfect. And they even learned how to spoil my dad, like my mom does. When we would get there in the morning, they would have gun smoke on. So my daddy can watch gun smoke while he was in the hyperbaric treatment. Then one day my mama forgot his coffee, because he drinks coffee all the time. So what did Brittany do? She went, got him a cup of coffee. So every time mama would forget her coffee, they would spoil dad. But most importantly, in my dad's darkest days when he was discouraged, they would encourage him and they would push him, and they really did push him till his last treatment. My family and my dad could not have gone through this ordeal without the expertise of these doctors and nurses at this facility. It took everyone working through God to perform my dad's healing miracle, and we will forever be thankful.
I guess thank you, Angela. Thank you, sir, very much so, Mr. Roy. And thank you to our team. I think sometimes we miss, many of us have picked healthcare as our profession and our life. And it's not because we want to be highly skilled in a lot of areas. That comes from a book. What doesn't come from a book is the heart that it takes to care for people. And our team does that. And so maybe it's Gunsmoke, Bonanza, or whatever you'll get next week. It might be okay, but it's just making sure what's important to the patient isn't always important as much to the clinician. And I say that because we look at it from a clinical perspective. But when you're able to sit in somebody else's shoes and take the time to say what makes you comfortable, and that might be a certain TV program or a little cup of coffee or just a little piece of, come on, you can do it, that makes a difference, doesn't it? And so that's who we are and why we are, and that's why we choose the people that we have working for us in healthcare, and it makes a difference. One of those people, again, well, Dr. Mike Isabel, who's a big part of what we do. He's our medical director, and he does the overview and treatment plan for the patients. So I'll let Dr. Mike Isabel come on up and explain what a day in the life is. How about that?
Well, good afternoon. Let me just tell you guys that I've been working here at Terrebonne General, affiliated Terrebonne General, for a multitude of years, now I think it's over 30 years now, and I've never been prouder of an accomplishment than I am of this accomplishment. And I want to thank the hospital administration, what we call the C-suite, thank them for their insight in developing this programming and essentially giving us everything that we need to be successful. So thank you guys for all the input and all the support you've given us over these last 5 years. My goal here today is I just want to provide you with a little bit of education about what we do in the realm of hyperbaric wound care. So it's a process we take a patient through. It's literally a 7-step program. And the first part about this is, again, we need to assess our patient when they come to the clinic and find out just exactly what their needs are. And we basically do this in a 7-step process. And the first step of that process is taking a look to make sure that there's good blood flow in and out. And the reason that this is so important is because you can't fight infection unless you have good blood flow into the area. So we've partnered up with CIS. They've been an integral part of the things that we're doing. Again, we use multimodality, a multitude of individuals within the institution to provide care to these patients. So anytime somebody comes in with vascular compromise, either venous or arterial, we end up sending those people to CIS, and they fix them. They do things to them that open up those blood vessels and allow us to do what we do and be successful at it. So thank them as well. The next thing, obviously, is to treat infection. You can't cure a wound if it's in an infected state. It puts it into a chronic situation, and until you get that wound cleaned up, the wound's not going to heal. Thirdly, we're going to clean that wound up. So all of the cellular debris that happens in that wound over the period of time that there's an opening, we need to go in and we need to clear that out. We call that debridement. It's a surgical procedure, and that's really where the nurse practitioners and the physicians come into play. We're the ones that do the surgical debridement on the patient. Next is to take care of their metabolic state. The big thing that we worry about, especially in diabetics, because they're the majority of our patients with diabetic foot ulcers, we need to make sure that their blood sugar is being well controlled. We measure that with what's called the hemoglobin A1C. And that hemoglobin A1C is a marker of how well their diabetes is being controlled, because bacteria love sugar. And so when they'll get there, they'll get into the wound and they'll set themselves up. And until you get that hemoglobin A1C, you're not going to be successful at clearing that wound up. Some of the other things that we do, especially if it's a pressure ulcer, if we keep on putting pressure on that ulcer, most of the time these are on the foot, but they can be in other areas of the body, but it's most commonly in the foot. We would put something that's called an offload or a cast along those lines to basically leave a little hole to take the pressure off of that area of skin so that it can get some blood flow. And it works very, very, very nicely. Then we need to, of course, optimize the host and make sure that everything else, all of their chronic medical problems, are being managed appropriately, and we do that in conjunction with the primary healthcare provider. And lastly, what we do is the advanced modalities, which you guys hear, the big hyperbaric oxygen therapy. Hyperbaric oxygen therapy is an adjunctive part of this entire process. It's when the first part of everything that we do is unsuccessful, and then we have to go to a more advanced modality, and that's where hyperbaric oxygen comes into play. And lastly, there's other little things out there that we can do, substrates, fake skin, things along those lines to cover the wound up, protect the wound, and make it heal faster. So again, thank you guys. I appreciate the award, and I can't wait to do it again.
For those of you who aren't medical, he just said we fix you in a good environment. How about that? So thank you so much. I think overall, we're extraordinarily proud of our award. We're extraordinarily proud of our team who helps us win this award, but most of all, we're very, very proud of the patients who choose us. Because you choose us, it makes us amazing and it makes us great, and it keeps us on our toes to always do a good and better job, right? So we have a lot of modalities. We always want to be first and foremost in our community and our region, and even further on the things we provide. Restoratives, thank you for recognizing all those energy and efforts, and we appreciate it.